Hello.
Hello. It's headquarters of CDC. CDC's headquarters, we have 12 independent centers that include AIDS, infectious diseases, and virology disease. So respond to COVID-19, we have a set collaborative mechanism, so we get all the professionals working in this building.
So this is where the response to COVID-19 was being planned, was being coordinated.
It's a headquarters of CDC. All the planning are here, and also all the direction and guidance produced here. So we mobilize all the resources to make this response timely. About a few hundred people working here. Yeah, a few hundred people working here.
What do they normally do? Where do they normally go?
So for us, what we do is most important. We have sent a team to the field, do investigation, assist the local to make investigation, and also we have a group of people working here. One of group is writing guidelines. So we have to, response like prevention and control guidelines. Another group is to do data analysis. We every day in the midnight we download all the reported cases from local. They use notifiable disease system and
all over China.
All over China. So
to the province, to the cities, to where? To all the way to the grassroots. To what level?
I think the notifiable disease system is from a township hospital. They directly, electronically reported the case to the server. The server, it's in the China CDC. So all the electronic file, then we download it. Then we have analyzers. Every day morning, before 6 o'clock, we need to finish the data analysis to present the updated epidemic.
So people were working overnight?
Yes.
There are some people working
overnight.
Why do you need it for? Why do you need these analyses?
This information is very important to tell the public and officials to understand the epidemic change. So that time we get pressure to tell the trends every day.
When was the first day? Do you remember that they started doing this?
Oh, it's January 16th. We initiated the first, the level 1, the level 1 response. Level 1 response is the highest response mechanism.
I see.
Yeah.
Okay.
We have about 50 people working here, day and night, just for their data analysis.
Do you remember the moment when finally you said, we think we know when the turning point is?
Yes, I still remember. I think I made a bold step, and in the January 30th, when CCTV, we have like 1+1 news, and at that time, the epidemic reported case continued to increase day by day. Then at that time, we clear the epidemic has already reached the turning point.
You made that statement?
Yeah, I made a statement.
Based on what?
Based on the epidemic analysis. As I told you, we look at the data of onset illness, not of data of reporting.
You looked at data of
the dates of onset of illness. So that's earlier than the reporting dates.
I see.
Yeah. So that it's clear the epidemic turning point already reached in the late January.
And it was a correct
It's correct. Yeah. But I think we are confident. We have assessment. We are confident it's clear. Also, we already have the shutdown policy. All the provinces take a very rigorous response. So for any respiratory infectious disease, that's all prevention measures ever we can take. So no more beyond that. So we are very confident. So that prediction was correct. So you can check, like you can check a record, the January 30th. Yeah.
It was on the record.
Right. Here's another team we call the epidemiological team. Epidemiological team is mainly to do data analysis, also to interpret any like cluster epidemic, particularly for like the new phenomenon we observed, then we need to interpret, we need to respond.
So what are you doing here with this computer, what you do?
To update the epidemic grade, international epidemic grade. We classified the epidemic into 3 levels, high, medium, and low risk.
The risk assessment.
Yeah. According to several indicators, and this is a comprehensive evaluation. Yeah. The second task is about to update the international coronavirus epidemic data, to collect and update them. Yeah.
So, Dr. Wu, how would you compare the CDC in terms of its function in COVID-19 response, and how would you rate its performance now that we are kind of behind the epidemic?
I'm always confident. So given the scale for our response, I give A or A+, because we responded very well. So I compare the response to COVID-19 with the 2003 response to SARS. So now this time we are very successfully controlled the epidemic, and also we made scientific-based evidence approach. And in terms of scientific findings and publications, we have many scientific findings published in the top journals like New England Journal of Medicine, Science, Nature. All these scientific findings translate to the control policy. The control policy implemented in the whole country, and we successfully controlled epidemic. So we have 2 big papers. Scientific paper in the scientific journal published, and also the great paper is printed in the face of people. So that's why I give score A or A+.
Well, I guess you deserved it. Congratulations. Thank you very much.
Thank you.